I don't know if my kids would agree with that totally, but I only have 3 kids. But that's enough for my wife and I. So thanks for coming tonight, and we're just going to talk about choosing a pediatrician and what goes on in the hospital and kind of what goes on in the clinic at the beginning. So feel free to ask questions during my talk. I'd be glad to have them at any time. Does anybody have any questions right off about what we're going to talk about or anything? Okay, well, I've been a pediatrician for about 13 years now. I grew up in South Dakota, but then I went to medical school here in Omaha at the Nebraska Medical Center, and then I did my residency here as well. And all of the pediatricians in our office trained here in town, so we're kind of local that way. There's 4 of us at our office in Dundee, and it's an exciting year for us because we're going to build a new clinic this year. We're going to move to 48th and Dodge, just a couple of blocks east. But we'll have a new clinic, which is very exciting. We're kind of overdue for that. So I'll just get started. I do think parenting is kind of on-the-job training. Nobody can really tell you how it's going to be until you do it. But we'll try to cover the main things, especially as far as the pediatrician is concerned. And congratulations if you're expecting. So choosing a pediatrician, as with most things, asking family and friends is probably the best place to start if they've had a good experience or a bad experience. That may help you. You want to make sure they're covered by your insurance, which usually isn't too big of a problem. Location, I think, is important. We do have people that come from Iowa and some people from, a ways away, but majority of our patients are live or work around the clinic. You can end up going into the pediatrician's office, at different times, and so being close might be good. And you can do a getting to know you visit or a prenatal visit, we call it. That's going to be a lot like this, just kind of going over how things work and who works there and that kind of stuff. And then what happens after hours, how they take phone calls and how you can contact them. Our office has been lucky enough to get an electronic medical record the past few years, which is really nice, especially with children's hospital, because in the last year we now have all the specialists in our same system. So if a patient of mine goes to the cardiologist or the orthopedic doctor or whatever, their note and visit will be in my system. So that is awesome. Before, if I needed to get a hold of a specialist, I'd have to, take time to get to the phone, make a phone call, wait for them, all that kind of stuff. Now I can basically send them an email. So it's really made the children's system more efficient, and so that's been really nice. It's good for patients too because we have something called what's it called? Children's Connect. So with our electronic medical record, patients can email us questions, and they can make appointments for the next day, that kind of stuff, and look into the chart too. So just with the advancement of technology, it makes it easier all around. So as far as pediatricians, you might want to see what hospitals they go to. We go to most of the hospitals. I've decided not to go to the women's hospital just because I live close to my clinic and we cover Bergen and Clarkson and Emmanuel, and so it's a little too far out for me. But the 2 of the pediatricians in my office do go there, so there's going to be coverage issues. We cover for each other, you know, somewhat. So like on the weekends, I will cover all the newborns. The weekend I work, and so there's always going to be a little bit of that. So that, you might want to find out about that. And then it's good to know if your hospital has a NICU. That's important. And maybe what the NICU's like, or just if they have one, I guess is going to be good enough. In Omaha, most hospitals have a NICU in case the baby does get sick. And then board certification just tells you if the pediatrician is board certified by the Academy of Pediatrics, meaning they've taken all the regular tests and had the normal training and that kind of stuff. And then we're required to take tests periodically to kind of show that we're keeping up on things. Daycare is something else to look at. Usually you want to start early. Good daycares fill up fast. Again, family, friends, and location. And then there's basically 3 types of daycares. And they all have their pros and cons. A center is going to have more oversight and may offer more services, but it's going to be more crowded probably. And kids in daycare are going to catch more colds. They're definitely go through that during the winter months, especially. In-home daycare might have less of that, but less oversight, and you just want to know the person real well, and have a good feeling about where your kids are being seen. And then nanny services might be good, for some people's situation. So what supplies do you need? You don't need a ton of stuff, but you need a few things. Car seats are, wonderful things. I do a lot of exams after kids have been in car accidents, and usually they're just fine. If they're in their car seat, it's not common that they're going to have a serious injury unless it's a real big accident. Cribs and bassinets. Bassinets are nice just so you can have the baby real close to you, especially if you're nursing initially the first couple of months, and then put them in their crib, usually in another room. I think that's what most parents do. And then a big thing that I'll talk more about is just basically now we say nothing but the baby in the crib to keep them safe, no bumpers and blankets and that kind of stuff early on. Feeding supplies. If you're going to nurse, a breast pump is really nice, depending on what you plan to do. If you're going to go back to work at some point and want to save milk, then having a breast pump is really going to help there, an electric breast pump. Then a nursing pillow is nice. I think those are called a boppy. And, basic bottles, diapering and bathing supplies. So a few things. And as usual, the most expensive things are definitely not always the best, It's kind of simple things. So when you're ready to have the baby, go into the hospital, probably should have a bag packed. And just bring your basic things. You'll need the car seat. Some cute outfits are kind of fun. In the nursery, we'll have Hawkeye fans and Missouri Tiger fans. No, not usually Missouri. Usually Iowa, Nebraska, basically. Socks and hats and that kind of stuff. But it's pretty easy as far as you don't have to contact the pediatrician. That's the hospital's job. The nurse will ask you who you want to use. And if you haven't decided, then usually a pediatrician is kind of assigned to see those babies. So usually, if you just get to the hospital, you'll do okay. In the hospital, there's quite a few things that happen. After the baby is delivered, the baby's given an APGAR score, which is really kind of an outdated scoring system. It's a real tradition now, I think, and I don't think it'll go away, but it just kind of describes how the baby looks, how they're breathing, their color looks, and it's just a scale of 1 to 10, and most babies get a 7 or an 8. And it's not uncommon for babies to have a little bit of difficulty after they're born. They can have a low APGAR score for the first minute, and then a few minutes later be fine. So, and then a gestational age exam, with ultrasound and everything. The obstetricians are good at predicting how old the baby is and everything. They're not very good at predicting size. They'll be off by a pound or two a lot of times. So that's not uncommon. Don't be surprised if your baby is bigger or smaller than what they tell you. Um, but when the baby comes out, you can look at the baby and kind of get an idea of the gestational age, whether it's a little bit more premature than was thought. And then the nurses will do a few things. All babies get eye ointment to prevent infections. If the mom has an infection when the baby comes through the birth canal, it could possibly develop into an eye infection. And then vitamin K is given as an injection into the thigh, and that's to prevent a rare bleeding disorder. Most babies, aren't going to need that, but it's one of those things that if you happen to be the one that may have this bleeding disorder, you'll wish you have had the vitamin K, So that's really a standard thing. And then they check vital signs regularly, just heart rate, respiratory rate, and then blood sugar once or twice to begin with. If the first couple of blood sugars are fine, then the baby will do okay as far as those. It's not uncommon for a baby to have a lower blood sugar sometimes, especially if mom has gestational diabetes or diabetes. But usually that's not too much of a problem. Occasionally a baby will need to go to the NICU for a couple of days to be on IV glucose to help stabilize their blood sugar. It's just that transition, when they're inside mom does everything for the baby as far as the glucose supply, and then when they come out they have to do it on their own, and so there can be a little transitional period. Jaundice is very common. Jaundice is when babies get yellow, and that's something that's really changed in the past 10 years that I've been out in practice. When I first started, we would really just kind of look at the baby and kind of guess what their bilirubin level was. And most of the time we were right on, but sometimes we weren't. And the babies would come in after 5 or 6 days and just be too yellow and have higher bilirubin levels. And then we'd have to admit them back to the hospital, and that was no fun for us or the parents. And so now hospitals and pediatricians are much better about checking bilirubin levels from the start. And bilirubin is the chemical in the body that makes jaundice happen. So that's good. Hepatitis B vaccine is given to a lot of babies in the hospital. Hepatitis B vaccine is a series of 3, and there's just a lot of evidence that it's more effective if started at birth. In the United States, that's not a huge deal because there's not a lot of hepatitis B in the United States. It's much more important in Asia, where there's a lot more hepatitis B. So there, it's made a huge difference in their rates of chronic hepatitis and liver cancer from that. But here in the United States, it's not a huge deal. But it is recommended, and they do fine with it. And then pediatricians, we come and see the baby. Usually every day the baby's in the hospital. They get a hold of us. If the baby's born at night, we'll tend to come the next morning, and then we usually see the baby each day. All right, so what do we feed the baby? We can't go to cheeseburgers right away, so we got to start slow. And basically it's breast milk or formula, and it's mom's choice whether she wants to nurse or not. The Academy of Pediatrics recommends breast milk for the first year of life, and both have their pros and cons. But in the baby, looking for signs of hunger, rooting and restlessness, usually the baby will start to fuss when they get hungry. Breast milk, usually you're going to feed about every 2 to 3 hours, and most moms will start out on both sides, and the baby will nurse for 30 to 40 minutes, but usually by a month of age it's quicker. The baby may nurse for only 5 to 10 minutes per time and be done. From a bottle, the baby will take a little larger amount and not nurse as often, every 3 to 4 hours. And they start out with a half an ounce to an ounce, and then at a month of age, they're taking 3 to 4 ounces. And usually formula is best at room temperature, and then they don't take solids till 4 to 6 months usually. When I was a kid, when we were kids, I guess, your parents may tell you, oh, we started solids when you were 2 weeks old and that kind of stuff, but things always kind of change. Breastfeeding is beneficial because it's natural and it's cheaper. I looked online today, and I think it's anywhere from $1,000 to $1,500 or something that you might spend on formula over the first year, depending on what formula. But breastfeeding provides antibodies, which might be helpful in fighting infections, and many women enjoy the bonding process that occurs. And then lactation consultants are available at a lot of hospitals, and they will usually always see a first-time mom, especially each day that you're there. And at our office this year, one of our pediatricians, Aaron Laux, became a lactation specialist. So that's really nice for us because if a patient of mine is having a particular problem, I can refer them to her, and they can see her and that kind of stuff. Do you have a question?
Yeah, if you can't produce enough breast milk, can you do both?
Yeah, you can do both. Lactation specialists are very pro breastfeeding, and sometimes parents will get the message that they just can't bottle feed whatsoever if they're going to breastfeed, but that's not really true. A lot of moms will do both from the start. If you're going to breastfeed, you can probably just breastfeed, and you don't need to supplement right away. It's a very common concern. We'll go and see the mom the first day, and they'll be really worried that the baby's not getting enough. But the first day or two, babies are used to or set up to not get much milk. A little colostrum once or twice a day the first couple of days. And I always feel like that's our job to tell the parents when to supplement if they need to after 2 to 4 days. So we check the baby's weight real closely. That's really what is most helpful. So, so going back to your question, I didn't repeat the question. The question was, can you do both? Can you supplement and breastfeed both? And I think you can, for sure. So it just kind of depends on what you want to do. Formula is easier in some ways because you can tell how much the baby's getting. With breastfeeding, that can be a difficult question sometimes because you just don't know. And formulas now all have DHA and ARA, which are amino acids and fatty acids that are supposed to really just try to simulate breast milk. And probiotics are a new thing as well, which are like yeast in yogurt cultures that are thought to help just gut health, intestinal health in babies. Another benefit of formula is that dad can help feed the baby. And if the dads are feeling like, boy, this sounds like a lot of work, we're going to be so busy with this newborn, I put my next slide in to remind you that babies will nap for 3 to 4 hours at a time, and you can watch an entire football game sometimes with a newborn. When my son was born, I watched the whole World Series that year. It was pretty good. So it gets harder when they get older and they're fighting you for the remote control. I watch a lot more iCarly now than I wish I did. But so now I'm just going to talk about some different things that happen and that are common with newborns and babies. Spitting up is very common. Most infants will spit once a day. And a bottle-fed baby will spit up more often than a breastfed baby because a bottle-fed baby will tend to take more formula. But usually, if you're not overfeeding them, you can decrease it or minimize it a little bit. Although I will tell you that, probably some of your babies are going to be really spitty babies, and it's just going to be that way. It can drive parents crazy sometimes because they don't think it's normal. But some babies are just extremely spitty and will spit up every time they eat. And it doesn't go away usually until about 9 to 12 months of age. So that's something that can happen. But most babies aren't that way. Most babies just spit up a little bit. Um, but burping might help, avoiding exposure. And then the things we would worry about if it was extremely forceful or if there was blood or bile in the vomit might indicate a bowel obstruction, which occasionally happens. And then if just how fussy the baby is. Most babies don't need medicine for spitting up, but some might benefit from something like Zantac that helps decrease the pain associated with spitting up. It doesn't affect the amount that they spit up, but just the discomfort. Okay, circumcision. That's kind of parents' choice. My wife has this little saying, "You've got to know," and that's kind of how I feel about circumcision. It's just a personal choice. In the Midwest, most people still have their babies circumcised. Um, but I don't think there's strong medical reasons one way or the other for circumcision. I really think it's just a personal choice. Um, and either the pediatrician or the obstetrician will do that. In our office, none of us do circumcisions. And I think probably about half of pediatricians do, but usually the obstetricians are very happy to do it. And they don't take a lot of care. They look yucky for the first week. Afterwards, they'll get some swelling and yellow scabbing and stuff, but they usually heal up just fine. Bathing a few times a week is fine. Checking your hot water heater is important. The difference between 120 degrees and 140 degrees is huge. If it's 140 degrees, little kids can burn themselves very easily. And then as far as the umbilical cord, they used to have parents clean them multiple times a day, and now we don't do any of that. We just say keep an eye on it, and they usually are just kind of dry and then fall off after a week or two. And so those are pretty easy, and it's rare for them to get infected. They can get infected, but I have not had one in my practice get infected. And you just want to do a sponge bath until the cord falls off, and then you can do kind of a regular bath in a little tub. If you do a bath before the cord falls off, it might increase the risk of it getting infected. And then trimming nails is something I used to ask my wife to do because it's kind of hard. There's no easy way to do it. I think that a clipper works best. Some moms will chew the nail off or tear it off or file it, but a clipper probably works best. You're gonna nick them and it's gonna bleed a little bit, but after you're done, they're usually fine. The babies are pretty tough that way. They don't seem to mind it. So discharge from the hospital, usually if you have a vaginal delivery, you're going to be there 2 to 3 days. If you have a C-section, 3 to 4 days. And most of the time it's the shorter time period. And early discharge is not recommended. Kind of depends on what time of day your baby is born. But if say you have a baby at 5 p.m. today, going home tomorrow isn't a great idea. You're going to be tired. And so just having that extra night in the hospital, I think, is really a good idea. I also think it's better to go home in the morning because then you're kind of fresh and you have the day ahead of you to kind of get settled. If you go home at night, may not be as good. And as far as the baby, too, we really like to have that extra day in the hospital to keep an eye on the baby. They're brand new. If we examine them once and we think they look healthy, they probably are, but you can't tell everything right away. And so in the mid-90s, a lot of babies would go home earlier, and I think it was partly due to insurance companies trying to get people out a little bit. But a lot of babies came back, a high percentage, higher than you want, percentage of babies would come back to the hospital with problems, either low temperature, high temperature, or jaundice, or not feeding well, or all those kind of things. So just having an extra day in the hospital, I think, is smart. And then when you go home, we ask you to keep track of the wet diapers and stools. That's an important indicator for how the baby's feeding. Um, and stools will start out with real dark tarry stools, and then as they take more and more milk in, they'll become yellow and seedy. And that's a really important thing. That's if we hear that a baby is not stooling well, usually it means that they're not feeding well. So those kind of go hand in hand. So jaundice, I talked a little bit about. Very common, 1 out of 2 babies. Peaks on the 5th day of life. Usually the level is around 12. It's just a lab test that we order. And it's nice in the hospital because they can check bilirubin levels with a little meter. They don't have to draw blood on every baby. So the first level, you can do this little meter and get a number. And if it's low, you're good. You don't have to worry about it. But as they go higher, then we do a little heel poke and draw blood and then look at that. And we will treat the baby with phototherapy if the level reaches around 20. And phototherapy is a certain wavelength of light that just helps the body process this bilirubin chemical. Makes it water soluble so the babies can pee and poop it out. And these really, I like the story of how this was discovered. There was a convent where these nuns took care of orphans. It's like in the 50s. They have all these babies, and they noticed the yellow babies that went outside in the courtyard would be less yellow than the other babies who didn't. And so they really just discovered that certain wavelengths of light helps treat this condition. And jaundice is not, it's one of those things. It's not harmful at low levels, but at extremely high levels, it can be harmful, and it can stain the brain and cause brain damage just because of the pigment staining the brain cells. And there was an article just last week that you may have seen in the paper that talked about jaundice associated with autism. And that's new. And I think at this point it's a correlation. They found a correlation between babies having jaundice and maybe an increased risk of autism. But it's not something that is thought to be a cause at this point. And you just kind of we'll have to see how that one plays out. As of yet, we don't have any specific cause for autism itself, other than some probably thought to be somewhat of a genetic condition. So parents will often ask about specific things in babies. Baby reflexes, the startle reflex. You've probably seen if there's a loud noise or you kind of drop the baby, they'll shake like that. Can be a little scary, I guess. And then rooting, sucking, grasping with their hands. Those are normal things. Most babies' eyes will cross a little bit. That's normal. Periodic breathing is a common question. And what that is it comes from babies' brains being immature and their nervous system being immature. And so when we breathe, it's very regular, in, out, in, out, in, out. And when babies breathe, it's just irregular. It doesn't happen as regularly. And sometimes they'll hold their breath for 5 or 10 seconds and then take a bunch of catch-up breaths. And so it can look like they're breathing funny or fast, and they are to some extent. Hiccups are very normal the first month. Rashes are pretty normal. A lot of babies the first week will be kind of red and blotchy all over. Things that we worry about would be not moving a particular body part, an arm or leg or something. And sometimes in babies, that gets overlooked a little bit because they don't do a lot to begin with. rhythmic movements like a seizure, or if a baby is extremely stiff or floppy or something like that. Babies do get fussy sometimes, some more than others. Um, and usually they're trying to tell us something, I think. They're maybe tired or hungry. They might be sick, or they may just have colic. Colic is a description of a baby who's just pretty darn fussy for the first couple of months of life. And that can be really stressful. That's some of the hardest visits, when you just have a really fussy baby, because parents, get pretty frustrated. It's a long couple of months. But it goes away. That's the good thing. That's what I always tell them. It's going to go away no matter what we do. 3 months from now, we'll all be smiling. And so what do you do with a fussy baby? There's a lot of different things. Usually, babies will, the first 2 weeks you get a pass. That's the good news. It's unusual for babies to be fussy during the first 2 weeks unless they're really colicky. Sometimes the first day they're just fussy. But usually not. Usually they're not fussy for the first 2 weeks, and then they usually get fussy at 2 to 3 weeks, and most babies will have a fussy period in the evening for a period of time, maybe 10 or 15 minutes, where they just have a hard time settling down, or maybe an hour or two is still considered normal. But you can try lots of different things. They like motion, so walking, car rides. I actually had a phone call a couple of weeks ago from mom, and she said, well, Dad slept in the car in the garage with the baby last night because they were trying to settle the baby down. And so that's pretty funny, Dad's out there sleeping in the car. But you do what you can do to get them to quiet down. And that's not recommended. We don't recommend to sleep in the car. But the thought is the first couple of months you can't spoil a baby. You can't hold them too much. You can't rock them too much, because they usually have a need, and maybe just they want to be held, and then usually after that they'll get on more of a real schedule of sleeping and that kind of stuff. And of course, you never want to shake a baby, and that's something I try to focus on a little bit with real fussy babies, because it can be extremely stressful. Just want to make sure that the parents have support and that they are able to cope with it, and that they have a plan as far as what they're going to do if they're kind of getting at their last straw. Milk protein intolerance is not super common. It kind of goes along with fussy babies because it can be a cause of fussiness. But usually happens during the first 1 to 3 months of age. And they can have mucousy or blood-streaked stool sometimes. And basically it's not a true allergy, but more of an intolerance. And what happens is the baby's intestine doesn't digest the milk protein very well. So it's not lactose intolerance, it's not the sugar in the milk, it's the cow milk protein that mom would take in if she's breastfeeding, or formula, because most formulas are made from cow milk protein. And if we think that's what's going on, we'll have mom take milk out of her diet. We won't have her stop nursing. And then if they're formula fed, there are formulas where the proteins are broken down into smaller pieces, much easier to digest, and that will usually help, and the baby will get better. And they outgrow it by 6 to 12 months of age. So it's not the worst thing in the world. It's probably a little overdiagnosed as well. The problem is there's no good test for it. The only test would be actually doing endoscopy and biopsy and that kind of stuff. And so you're not going to do that unless it's a major problem. So beyond that, it's kind of an educated guess. So signs of illness in a newborn that we will tell you to watch out for is a fever. And we go by rectal temperatures in babies. Sometimes parents will be a little nervous about rectal temperatures. I did have a patient a few years ago who I admitted to the hospital because of a low temperature. And it turned out that the parents were so nervous about taking the temperature, they weren't really sticking the thermometer in the baby's bottom. They were just kind of, touching it. And so the temperature was low. And so the baby did fine. Um, but other things would be if the baby's not feeding well, because that's kind of their only job is to eat and pee and poop. So if they're not feeding well, it might tell us that they're sick in some way. If they're having difficulty breathing, once again, the forceful vomiting or bilious vomiting. And then if they're just extremely inconsolable or fussy, or if the parents just feel like something's wrong, then we need to check them out. Sudden infant death syndrome is the leading cause of death in infants between 1 month and 1 year. And that says a lot, I think, that now with vaccines and antibiotics, kids are generally healthy, That's one reason I really like my job, is because most of the children are very healthy. It's a very healthy population. Sudden infant death syndrome does occur, but it's rare. And it's preventable. In the last 10 to 15 years, there's been the Back to Sleep campaign, and it's definitely made a huge difference. And basically it comes down to having the baby sleep on their back in the crib without extra blankets or anything like that. And the thought was that before, when babies slept on their tummy, that they might not breathe very well, get their face into the mattress, and if they were sick with a cold or something, that at some point they would just stop breathing because of that. So now having them head up, face up, really seems to have made a big difference. Monitors are okay, but they have not been shown to make a huge difference. If you think about it, if your baby is real quiet, you're not going to hear that on the monitor. You're going to hear if they're crying, though. So I mean, they aren't a bad thing, but they're not strongly recommended. And we don't have babies on a lot of monitors either, as well. Babies who are born prematurely will sometimes need to be on monitor for a short period of time, but beyond that, we don't use a lot of monitors at home. And then no co-sleeping. I think it was the last year or two, the Academy of Pediatrics came out with a statement that said, we don't endorse co-sleeping anymore. Before, they kind of didn't say one way or the other, but now it's thought that it's probably not a good idea for the safety of the baby, basically. And then especially in couches. Couches are bad news because there's just not enough room, and it's easy for a baby to kind of get stuck between the adult and the couch. So at home, when you go home, it's important to sleep when the baby sleeps. So your sleep schedule is going to be a little goofy, but learning to nap when they nap might be helpful. And then it's important to put the laundry and the house cleaning on the back burner. I still remember at home with my first child, it was a couple days after we were home, and my wife was vacuuming, and I thought, that doesn't look that right, And about an hour later, she just broke down, bawling. Oh, I feel terrible. I shouldn't have done that. She just didn't feel good because she just had a baby and she was wore out and she was tired and all that. So it really is important to give yourself a break and allow yourself to rest as much as you can, and allow family and friends to help you if they can by doing most of the chores. If moms come to help, it's better for the parents to try to do the baby cares and other people to do other stuff. You want to try to eat and drink to stay up on your nutrition. And then especially during the winter, have people wash their hands. Washing hands is by far the best thing we can do to prevent the spread colds and infections. So don't be bashful about that. I recommend keeping babies out of daycare for a period of time. If you have to go back to work and the baby needs to go to daycare, that's life. But I don't like having a 1 month old in the gym daycare or church daycare during RSV or influenza season. If you can kind of keep them a little sheltered at the beginning, that's probably a good idea. Going for walks is great. Maybe not right away, and it's going to be winter here, but eventually you want to get out there. And then the other thing is it's normal to get the baby blues, especially for mom. A lot of changes in your body and having a new baby and new responsibilities. So it's very normal to feel a little down and cry at times. But definitely ask for help if you need it, because there's help available, and having a newborn, can be stressful, but it gets better. And so what we do is we see the baby in the hospital, and then usually we'll have you follow up in the clinic a couple of days after you go home, and sooner rather than later. We'd much rather see a baby a couple of days after you go home, make sure that you're all doing okay, rather than 5 or 6 days later when the baby's not feeding well or having jaundice and stuff like that. So what we do at our office is we call you the next day, and the nurse will call you and run through some questions about how you're doing and how the baby's doing. And then if you're doing great, maybe we'll see you in the next day or two. If not, maybe we'll see you that day. But it's quick transition from the hospital to the clinic. So we check the baby's weight, see how they're feeding, and follow up on jaundice. And that's very common. Then we do a 2-week checkup where we do more of just a regular checkup where we check the baby head to toe. We talk about vitamin D for breastfeeding babies. Breast milk is low in vitamin D, and so it's recommended to give it to the babies as a supplement. And the only problem with it is it doesn't taste very good, so a lot of babies don't like it, but we try it. It's not that critical of an issue, though. And then the newborn screen is back at that time. Newborn screen is a little blood test they do, and they test for about 10 or 12 different illnesses. And those include like the thyroid gland, cystic fibrosis, hemoglobin disorders, and some other rare things. And then immunizations start at 2 months. And then kind of the regular checkup schedule, there's a lot in the first 18 months, 2, 4, 6, 9, 12, 15, and 18 months. But then after that, it's yearly. So when the kids get bigger, we don't see them as much. And kids in the state of Nebraska are required to have a kindergarten visit and a junior high visit. And in kindergarten, we check their vision and hearing. That's the main reason for that. And then to make sure they're up on their vaccines. And then we do a lot of sports physicals and kind of a college physical. Some colleges require certain vaccines. And so some final thoughts. If you get unsolicited advice from family and friends, smile and say thank you, and then consider that advice and then follow your own instincts. And as pediatricians, we're here to help you and answer questions. I always view myself as a consultant. I'm a consultant to the parents. I'll tell them what I know, and then it's their job to make their best decision. And cherish these moments. College will be here before you know it. That's a little bit of an exaggeration, but it does go fast. The first year especially, parents always come in at the 1-year checkup and they're like, oh my gosh, it went so fast. So, all right. Well, thank you. And are there any questions? Better than I thought. I thought it would only be about 25 minutes. Yeah.
I know you said no blankets or anything. When is a good time to introduce? Like
Something like a blanket. Well, initially, uh, layers are better. So, like during the winter, a baby might be in a onesie and then a sleep sack. A sleep sack is like a little sleeping bag, and those are great. Baby's going to be toasty in there. And another thing that parents ask about is the baby's hands and feet will be very cold, and that's just babies. Seems like it's maybe more noticeable in the wintertime when it's maybe a little cool in the house, but um, the risk of crib death decreases after 6 months of life. It's most common at 3 to 4 months of life. And so I would say definitely after 6 months, maybe 9 to 12 months of age when the baby is very active. Usually babies will sleep on their back, and then around between 4 and 6 months will start rolling around more. And so a 6-month-old baby a lot of times will sleep on their tummy on their own. And so then they're probably big enough and strong enough to sleep on their tummy on their own, you know. But as far as a blanket, I would say no hard and fast rule, but maybe 9 months or something like that. And they're not going to really know the difference. So, yeah.
How do you suggest addressing secondhand smoke for people who have family members who come in and
Right.
my husband and I aren't smokers, but we have a lot of family members that are, and that's one thing that does concern me. So I'm not sure. And I know there's been a lot of reports even about third-hand smoke, and I just want to know what's the line to draw.
Oh,
Crazy over it.
yeah, that's a tough one, you know. My mom smoked a pack a day for 20 years, you know, before she quit. So I remember a lot of cigarette smoke exposure when I was a child. But, you know, smoke can stay on clothing, and so if they hold the baby, that's going to be irritating to them. Um, you know, I think what you could maybe do is if you smell smoke, you could maybe cover their clothing with a blanket. I mean, do you think this is someone who would hold the baby?
Oh, yeah.
Yeah. So I would point blank tell them early on, look, we really want to try to minimize the smoke exposure. So could you try to help us with that for the baby's benefit? See if they'll work with you a little bit. And then, you know, as long as, you know, obviously you're not going to let them smoke in your house or, you know, but it can be touchy. You don't want to be too, you know, don't want to alienate them if it's a family and things like that. But I think I'd be comfortable with if you use a blanket as a shield, maybe the best you can do. Sure, that's a good question. Every day I get a new question. You know, a parent will ask something, and you know, it's like, wow, I never thought of that one before. So, yeah.
Regarding the pediatrician consultation, like you said that there is on the second day there is an examination of the baby. So is it done in the hospital where we deliver, or we have to call in the pediatrician specialist?
In the hospital?
Where we go for delivery?
Yeah. No, the pediatrician will come and see the baby each day in the hospital.
The pediatrician which we are going to consult for future visits, call them specifically.
No, the nurse will ask you when you check in who your pediatrician is, and then they will call the pediatrician after the baby is born. So then the pediatrician will know to come and see you. And they'll come and see you each day. And it kind of depends on the hospital. If you want to keep your baby with you in the room at all times, that's great. If you're tired and you want a nap, it's fine to send them to the nursery for a little bit. And so it just depends. Sometimes we'll examine the baby in the nursery if they're there when we round in the morning, or sometimes we'll examine them in the room. But we'll always come and talk to you afterwards.
Pre-delivery consultation with the pediatrician.
Kind of depends. Not all people. Some people do. Some people don't. You know, if if your best friend says, "Hey, this is the best pediatrician ever," you're gonna love them. Maybe you don't need to. I don't know. To us, we're kind of used to it a little bit, so it doesn't make a huge difference. It's more if you have some specific questions. Um, what I covered tonight is a lot of what we would cover with the parents. So it just kind of depends. And just kind of making sure that you match with them personality wise a little bit, you know. Yeah.
When we were registering, there's a lot of like swaddling. Like they're right next to the sleep sacks. Are they the same, better, or?
Well, that's a good question. Swaddling is probably okay if you're holding the baby. Say you have a fussy baby, a colicky baby. They do like swaddling. They'll settle down, they'll quiet down, they'll sleep more soundly. Like if you take a baby who's fussy and you wrap them up tight and you lay them on their tummy, they're gonna settle down and quiet down, but we worry they might settle down too much, you know what I mean? And so it's definitely not recommended to swaddle a baby while they are sleeping. It's better to have them flat on their back in a sleep sack or something where they're free to move. So, you can, I wouldn't buy a specific, you can swaddle a baby with a blanket, just fine. It's kind of like carriers or slings. Some babies will really like that, carry them around in a sling. So, does that answer your question? Right. And that's really confusing for parents because at the hospital, they're gonna bundle your baby up with 3 or 4 blankets. And the reason they do that is because babies, the first couple of days of life, don't regulate their temperature real well. And so they can get cold. And so the reason that the nurses at the hospital wrap the babies up in 3 or 4 blankets is to keep them warm. But they also wrap them up tight, So it's a confusing it's a mixed message, I think, for parents. Like, why are they, they swaddled them, why can't I? But it's really just to keep them warm. And then later on when they're sleeping, it's safer to not do that because it's rare for a baby to have major problems with keeping their temperature up. First day or two, maybe a little bit, but then after that, their thermostat is working and they can keep their temperature just fine. Yeah.
After the first couple weeks, do you think it's better to start a feeding routine, or do babies just kind of establish that on their own?
They'll establish that on their own for breastfeeding more. Yeah, the first week of life, 2 weeks of life, I tell moms to try to nurse more often than less often. So you really want to shoot for every 2 to 3 hours during the day. And at night you can go a little longer, like 3 or 4 hours. But you want to shoot for 8 to 10 times every 24 hours because that will help your milk come in more and it helps the baby get more. And then the schedule will just kind of follow after that. And they'll eat, they'll fall asleep, they'll poop. No, they'll eat, they'll poop, then they'll fall asleep. And just it'll kind of happen naturally and you'll figure it out. So it's, in the 70s, they were really big on schedules, like 7 o'clock, baby eats, no matter what, But now it's a little more, realistic. You want to try to have a normal schedule. Like if you're a late night person, your baby is going to be more of a late night person. If you're an early morning person, your baby's going to be they'll adapt to whatever your kind of routine is. Yeah.
What about traveling?
Well, if the baby's born in the winter during the holiday season, you're thinking maybe you're going to go visit somebody, I tell parents I would not plan to travel before 2 weeks because at 2 weeks you want to babies always lose weight during the first week of life. That's normal. And it takes them until 2 weeks to get back to their birth weight, which is really amazing. They don't get back to their birth weight until 2 weeks. And so I'm not comfortable telling someone to travel unless they just had to, and I don't know. But I would wait until the feeding is well established and they're doing well and all that kind of stuff. And then beyond that, it's just a personal choice. It's easy to travel with a baby. They're little and they're not going to run away from you like a toddler. So it's a good time to travel during the first year of life. But it comes down to exposure and what your comfort level is there. So the first set of vaccines are given at 2 months of age. They can be given as early as 6 weeks of age. So sometimes some of my families who they grew up in another state and they're going to be going back for a period of time, will try to get the vaccines in just a little earlier. So the second set of vaccines is an important set of vaccines because it kind of boosts the child's immunity and might protect them from some of the more serious illnesses. So I liked it when they get that second set, but it's not going to protect you from things like RSV or influenza, things like that. Oh, that's something else that I didn't put in, but I'd like to mention. It's important to get a flu shot for parents because babies can't get a flu shot during the first 6 months of life. It just doesn't work in babies. For some reason, they don't respond to it well enough to be protective. And so if babies get the flu shot, they can get it at 6 months, and then they get a booster a month later. And this year, the flu vaccine is a combination of H1N1 and seasonal influenza. Last year, there were 2 separate vaccines. So it's a good idea for parents or any caretaker. If grandma's going to be watching the child several days a week, she should get a flu shot. And then the other thing that we're recommending more each year, past few years, is a pertussis booster. And you can ask your obstetrician about that. You can't get it while you're pregnant, but then after the baby's born, in the hospital, they will give mom a pertussis booster. And any caretaker should get that. Dad, grandma, grandpa. It's just a good idea for most adults to get a pertussis booster because pertussis is particularly miserable illness. You cough for 3 months straight, but it's a very serious illness for infants, babies less than 6 months of age. It can be fatal or just terrible. Which one?
I have an egg allergy. I can't take a flu shot.
I don't know. I'd have to look. That's a good question. I don't know. There's not that much pertussis out there, but if you're the one that gets it, not good. So, anything else? These are all very good questions.
Is it true that if you're breastfeeding and you give your baby a pacifier, that they'll unlatch from your nipple and only want a bottle because they won't want your breast anymore?
Probably not. Ideally, you just breastfeed for the first few weeks and then maybe not even introduce a pacifier. But I have no problem with pacifiers. Some babies really benefit from them. If you have a baby that just loves to suck and suck and suck and suck, then they're going to like a pacifier. And sometimes what will happen is they'll use you as a pacifier. And, after 45 minutes, you're starting to get sore and all that kind of stuff. And so pacifier can be a good thing. And it's not common for a pacifier to interfere with breastfeeding. Same with a bottle and supplementing. It can happen. And ideally, you don't give a bottle during the first few weeks. But if you need to, and you do, it's not common for it to cause major problems. So it's kind of one of those things that people worry about happening a lot more than it really does. A little plug for vaccines too. I know that sometimes people really worry about vaccines, but vaccines are extremely safe. In 10 years, I can think of 4 babies that had problems with vaccines. Two-month-old babies got high fevers, one 104, one 105. So pretty high fever, you know, for a baby. I hospitalized one of those babies to make sure they didn't have a serious infection, but they didn't. And then 2 other infants who cried for about 24 hours after their vaccines. So that's not good. I mean, they cry, you know, they can be very fussy for a period of time. But that's it. All the other kids, you know, have done fine. And we're pretty lucky as pediatricians now. We deal with a lot less meningitis and serious infections than a pediatrician did, you know, in the 1960s or 70s because of vaccines. So I'm very pro-vaccine. And I think the autism question has really been, you know, there's just a ton of evidence that we don't think there's a link there at this point. But some parents will come in and be pretty concerned about vaccines. At our office, we don't turn people away. We just kind of work with them. Most parents will come around. You know, some will want to wait until after the child is a little bit older. I try to convince them that that is a bad idea because you really want to vaccinate the child when they're little because that's when they're most susceptible to not doing well if they do get a serious infection. You know, a 5-year-old's going to do a lot better than a 6-month-old if they get meningitis, as far as being able to fight it off and that kind of stuff. Usually we'll work with you and, you know, try to convince you to vaccinate the kids. And that's what happens a lot of times is people will not initially, but it's still very few numbers. Majority of parents immunize their kids. What else can I say about that?
One more question about
Yeah.
travel. Like, when is it safer? Like, after which age is it safe for overseas travel?
Oh, air travel, airplane. Just depend. A month or 2, kind of depends. It's not so much the travel; it's the exposure to the people, you know. So, I stayed not before 2 weeks, maybe not before a month or 2. But I did have. I don't know if they flew, but I had a set of triplets, and their parents took them to Breckenridge skiing when they were 3 months old. Most parents wouldn't do that with one baby. You know, you'd be like, oh, we can't go this year. But it was like a family thing. So they went with their triplets skiing. So that was pretty impressive. So, but I think car travel is probably harder with a newborn if you're breastfeeding, you know, because you don't want to take them out of the car seat now. So if you're going a fair distance, could be a lot of stops, you know. And I had one other, they were triplets too, another family. They were 10 months old, but they drove to Louisiana in a car with their triplets. And then when they got back, they were like, we're never doing that again. And so, you know, it's just kind of a personal decision, I think. Any other questions? All right, well, good luck to everybody. And there are some cards up there. If you want to come up and ask me a question up here that's more personal or something, that's fine. Be happy to hang out. So.